Well, talking about cancer, knowing the facts about that disease and women can help with both early diagnosis and life-saving treatments, too. 6 is on call this afternoon. We're joined now live on the broadcast by Ochsner Gynecologic Oncologist, Dr. Lisa Bazzett. And Dr. Bazzett, it's always good talking to you. What an important topic that we have with us this afternoon. Recently, we've heard the term radical hysterectomy. What exactly does that mean?
Well, a radical hysterectomy, it's not a new procedure. It's actually a very old procedure, specifically to treat early stages of cervical cancer.
All right, and there's another term here as well, getting a little crash course in medicine with you, Dr. Bazzett. What is uterine sparing surgery, and who really is a candidate for that?
Well, uterine sparing surgery, specifically in the cancers that I treat, are usually surgeries performed for younger women who may have a cancer that would typically require a complete hysterectomy. But very often, for example, in cervical cancer, this may be a cancer of younger women who have not completed childbearing yet or have not had any children at all. So what we try and do in that situation is try and do the procedure to remove the cancer around the cervix, but keep the uterus in place so that these women may be able to go on and have children again in the future.
You know, one of the interesting machines that you folks have there at Ochsner is that Da Vinci robotic system that you're using to treat female cancer patients. Talk a little bit about how that works.
The Da Vinci system, it is called a robotic system, but it's not actually the robot that does the surgery. The surgeon still does and performs the surgery. What it is a more advanced type of laparoscopic surgery that allows us to do bigger and much more detailed and technologic procedures with the laparoscopy setup so that we can do these big surgeries through a few small incisions instead of making a large incision. So the patients tend to do much better after surgery and recover faster. They have great outcomes.
Let's talk a little bit about the symptoms that people should be looking out for when it comes to cancerous issues in their own bodies, in particular women.
For cervical cancer, there are not a lot of symptoms in diagnosing it early. The most important thing is that women go in every year for their pap smear, and that's how cervical cancer is diagnosed early. Other symptoms to look for that are very important for uterine cancer, which is actually the most common gynecologic cancer we see, is any abnormal bleeding, such as bleeding in between periods, or in women who've gone through the change or gone through menopause. Any bleeding after menopause should be investigated by a doctor right away.
All right, Dr. Lisa Bazzett, of course, the gynecologic oncologist over at Ochsner. It's good to see you. Thanks for joining us today.
Thanks, Rube.